Administration may be abandoning a so-called public option is outraging a lot of the president's most assertive supporters. Let's talk about that and more with Democratic Congressman Engel of New York. Congressman, thanks for coming in.
My pleasure, Wolf. Thank you.
You may have noticed your hometown newspaper, the New York Post, with a headline on the cover today saying, "Sellout, liberals howl," as Obama caves on health plan. Is this a sellout by the president if, and it's still a big if he abandons in the final legislation what is called the public option?
Well, it's still a big if. I noticed that the president said that he still supports the public option and nothing has changed. I know that the secretary had mentioned the possibility of there not being a public option. Look, many of us, and myself included, I'm on the Energy and Commerce Committee. I'm the senior New Yorker on the committee. I support the public option. The final bill didn't have a public option as strong as we would like, but there's a public option.
If the dust settles and it comes out of conference when the House and the Senate put their work together, there's no public option, would you vote for it?
I'd have to think long and hard. I'd have to see if it moved health care forward. I tell you one thing, with a public option, it moves health care forward because that public option would force the insurance companies to keep their premium prices down to compete with the public option. So I think it would be a terrible miscalculation if we didn't have a public option. But I do expect the final bill that is going to be voted on the House floor to contain a public option, and then I hope that we can convince the Senate to keep in the public option because, again, we want the insurance companies not to negotiate with themselves to have the premiums high. We want to force them to compete with the public option.
Here's what Democratic Senator Kent Conrad, he's the chairman of the Budget Committee, what he told CNN earlier today on why he doesn't think there's enough votes in the Senate for the public option. Listen to this.
There have never been the votes in the United States for public option. That's just a fact. That's why I was asked to come up with an alternative, something that might bridge the differences here.
That alternative is the so-called cooperatives, healthcare cooperatives that he would like to see emerge with some government seed money, but they wouldn't be part of the government. Would those cooperatives satisfy you?
Well, I have to learn a lot more about those cooperatives. Right now, there's all kinds of conflicting discussion about them. The senator said that there was no support in the United States.
He meant to say United States Senate.
Okay. Well, there's a strong support in the House, and it takes two to tango. And it doesn't necessarily mean that the finished product will be what the Senate wants. I hope it means that it'll be what the House wants. We have to just see. I think co-ops are untested. We really just don't know, and I would have to be convinced that they would keep the prices down. The bottom line is to insure everybody, the 47 million Americans that don't have insurance, and to keep the costs down, and to make sure people don't lose their insurance if they lose their jobs or change their jobs, and to make sure there's no pre-existing condition where insurance companies are denying people coverage. We have to make sure that's all on the bill. I think the best way to do it would be a public option.
A quick question, because it's Jack Cafferty's question this hour. Of those 47 million people in the United States who don't have health insurance, it's been estimated by the Pew Hispanic Research that about 6 million are undocumented aliens, illegal immigrants in the United States. What do you do with them?
Well, let me first say that 80% of those 47 million Americans are working people and their families. In terms of the undocumented, look, they're here and they're sick, and right now they're using our emergency rooms as their primary care. It's costing us a fortune, and backing up, if we go to an emergency room, it takes 5 or 6 hours before people will see you. So right now we have a situation where we're paying for their care. We ought to have a situation where it costs less for everybody's care.
So, but should they be allowed to go into emergency rooms when the final bill passes, if it passes?
Well, I think that people who raise the issue of illegal immigrants is really a smokescreen. I think that this country has to come to grips with the situation, and I hope after we do health care and the energy bill, we'll come to grips with immigration. But the fact is now that when people show up in hospitals, nobody asks them for identification or for their status, and they're being served right now. This bill doesn't alter that one iota, and this bill is not a bill that would take care of illegal immigrants. That's a smokescreen.
Democratic Congressman Engel of New York. Congressman, thanks for coming in.
My pleasure, Wolf. Thank you.
We'll hear what Jack Scott